Hi folks, so we're here at UC Davis in lovely California. And as mentioned in our earlier post, we are here to interview Dr. Sakai, who was the treating surgeon on our very own little Ripley here, who was admitted for a joint infection. Just a little background on his injury. Got a call saying that he had injured himself. Our local vet came out to look at the laceration, which was on the inside of his knee. She was concerned about joint involvement and recommended that we bring him here to UC Davis. So that's what we did. We loaded him in the trailer and we came here, and then we met with Dr. Sakai.
As soon as Ripley got here, we were concerned about joint involvement. The veterinarian who saw Ripley in the field had bandaged the leg, and it was a fairly fresh injury. So the first thing we did was take x-rays of his carpus, or of his knee. We saw some gas in the area of the joint and were concerned, gave us further evidence that possibly the joint was involved. So the next step was to sample the fluid of the joint and evaluate whether or not the joint had been entered. When we did that, we had clear evidence of communication between the wound as well as and the joint. And so we came up with the plan to take Ripley to surgery and lavage the wound in surgery. Ripley was placed under general anesthesia, and an arthroscope was introduced into his carpus, and the joint was flushed copiously, and the wound itself was sutured closed at that time. The other things we did were place antibiotics directly into the joint, as well as perform intravenous regional limb perfusions. Basically, it's a way of getting very high concentrations of antibiotics into the lower portion of the leg. After surgery, Ripley did very well. He stayed sound the entire time. He never developed any lameness, and we continued to aggressively treat with antibiotics. Over the course of the next 10 days or so, we kind of backed off the amount of pain medications he was on. He was on Butte. He stayed comfortable, continued to improve, and after about 2 weeks, the sutures were removed, and he's been very comfortable since. Along the way, to kind of evaluate progress as well as his soundness level, we sampled the fluid in the joint, and we can monitor cell populations and other biomarkers that tell us about the health of the overall joint.
Dr. Sakai, can you tell us a little bit about wound preparation for travel if a local vet has a suspicion of a joint involvement and is recommending transfer to a trauma center?
So when your veterinarian comes out, if they're worried that there's a significant injury that needs to be seen at a referral center like Davis, what they're likely going to do is clean the wound well and then provide some sort of coverage and support. Sometimes soft tissue, ligaments, tendons can be damaged, and providing a heavy bandage or splint can help prevent further damage during trailering. So
Dr. Sakai, just as advice for owners who may just find the injury, and what should they do in between finding the injury and the local vet arriving to treat?
The best thing that we can put for initial treatment is clean, sterile saline if we have it. If that's not available, just tap water is good to remove the gross contamination, dirt, manure, those sorts of things, and then place a bandage on the injury to prevent further contamination until your veterinarian gets there.
We are very lucky to have UC Davis here within close proximity. Joint injuries are a very serious and generally life-threatening situation. So Ripley here is very lucky that we got him here in good time. We had a good local vet who recognized what the situation was, and we had great staff here at UC Davis to stack the odds in favor of this horse surviving, which thankfully he is, and we're very grateful.